Hello, my name is Crystal Petrie, and you are watching another episode of the Crystal Petrie podcast. On today's podcast, we are going to learn all about duck lips, going from duck lips to mewing when you're taking your pictures or doing video. And here to educate us all about that, it's funny just to say it, Jane. We have speech language pathologist Jane Butler.
Hi, Crystal. I'm so happy to be here. And
I am so happy to have you.
What a great tease. I'm just thrilled to be here. It's a beautiful day out here. I'm coming to you from Oregon, and I'm just happy to be with you this morning.
The West Coast, Oregon.
Yes, and thankfully not the wet West Coast today. So that's kind of nice.
Exactly. Okay, so Jane, you were telling me about this right before we came on air about the duck lips and the mewing. And I feel like I never want to have like an absolute and say everyone knows what duck lips are.
Right.
But a lot of people should know what duck lips are. It's whenever you're taking your pictures or you're in the video. And I feel like it really highlights like your cheekbones and things like that. Correct?
Right. And you saw that in the trends. I think the emergence of course, a pocket cell phone and taking selfies and people doing the, kind of posing. And we had jokes through film I think a lot of people, you would ask them if they've been around a little bit and they'd say, oh yeah, there was a lot of this going on, posing and posturing, and I think that, there's a little bit something to that. We've seen different facial goofy faces kind of over the years and people trying to highlight, aspects of their look and looking in the mirror and so on. And I think we used to say, oh, they're GQing or, they're voguing or what have you. And in our generation, and of course, I'm just absolutely flabbergasted that the younger generation now does something a little bit different. And I don't know if this is pervasive and across the country or the globe or where it's really sort of common. But what I'm seeing is something that the kids call mewing. And because I'm a speech language pathologist and I work interdisciplinary and collaborate interdisciplinarily, I meet people from all different sort of professions that work with folks around oral posture and dentition and occlusion and bite surfaces and all this manner of things. And I think the interesting thing is wondering if Mike Mew from the UK, an orthodontist, an incredible researcher and influential personage in my world, both of the Mike Mews, senior and junior, and knowing a little bit about them and wondering if there's something to this, since mewing captures correct mouth carriage. So you would have your tongue sort of plastered to the roof of your mouth gently, but you would have, your face, your musculature drawn in to sort of be theoretically supporting your bones, and the idea that you sort of grow around your function. So I find it cute and curious that kids will look at each other across the parking lot at, the high school or middle school, and they'll kind of go like this. Are you getting your jawline? That's kind of what they're asking the other person.
Let me interrupt you really quick, Jane. Are we talking about the father-son duo that has is it on Netflix? They have a Netflix special, or
I don't know. I'm not familiar with
Prime?
it. Oh, I don't know. I don't know if they have a Netflix special about the Mews.
Because I watched it, and you know what? I might have to look it up on my phone while you're speaking. I watched a father-son duo in the UK.
Yeah.
And they were both dentists, but they were talking about like braces and some other stuff as far as like your oral care and your teeth and how your tongue should function and things like that. And as you're talking about it, it's like coming to mind. And
interesting.
I think that's who you're talking about. But I'm gonna look it up on my phone while you're talking, so I'm not being disrespectful.
You're fine. And
so go back to the jawline.
Yeah, so they're looking at optimal, essentially optimal facial structural health over a lifetime. And you're prioritizing your airway. You're hoping to reduce effects of sleep apnea. You're hoping to Yeah, to keep yourself out of harm's way as far as aspiration risk or swallowing dysfunction, all that manner of those kinds of things are really more in the wheelhouse of the speech language pathologist, but certainly can become a priority for, any professional. And the speech language pathologist, of course, is really dealing with the soft tissue and the function and so on. And it is interesting. I'll be thrilled, and I feel a little maybe a little embarrassed that I didn't know that they'd had a special and a series potentially or a special done about them. But yeah, I've always followed what they were doing, for years. And yeah, and plenty of other professionals, in all the worlds that intersect with sort of where I've put my energy and time as far as a speech language pathologist. But I thought it was so cute. It was sort of something in pop culture. And I thought,
Yes.
oh, yeah, the boomers like grew up with a lot of sort of McCarthy perfection, forced on them with the stand up straight and close your mouth and all this stuff. And we really probably should, stand up straight and primarily keep our mouths closed.
Yes.
And I think that your mouth is generally for like, talking, communicating, and eating,
Right.
and not for breathing. And there's so many, literature grounded reasons why we know that to be the case.
Okay, so
And
let me interrupt
yeah.
you for a second, Jane. That's who it is. So the
Oh
name
yeah.
of the Netflix special, because I watched it. The name of the
Oh, this
Netflix
makes me really
special.
happy.
Yeah, the name of and no one, I'm not getting paid for this, but I'm excited
Okay.
about this conversation, and you brought it, and the fact that you brought it up. It's called Open Wide.
Oh
Open
wow. Oh, I can't wait.
Wide, and it's
Um,
on Netflix, and it talks about the father and the son,
yeah.
and they talk about like it says, I'm reading it, it says a controversial jaw reshaping technique called mewing. Yes.
Then that's definitely what the kids are.
Yeah.
And I'm just saying, in the middle school, and that's really exciting to me. I think that if you had told me, 20 years ago, oh, eventually you won't be this, person on an island, like loving these philosophies and
Mhm.
this, essentially science, you're not gonna be alone. You're gonna see this on Netflix. I probably first of all, I'd have been like, "What's Netflix?"
What's
I'm still a
Netflix?
little bit
Right.
like, "What's Netflix?" Yeah. But as far as like scholarly articles and presentations and publications and things of that nature, obviously I've been a follower for a really long time. I just didn't know about that Netflix special, but I obviously will. And I think that this is exactly what I'm talking about. Like the culture has moved. I'm not even keeping pace with how quickly these concepts are kind of permeating sort of day-to-day culture. And
Right.
what's fascinating is I actually found out about both of them through the kind of the figure athlete world a number of years ago, a long time ago. And it was through a thread where someone was discussing, this is a figure athlete who's wanting to drop body fat and was dissatisfied with his facial presentation and the way that, well, his he
His
didn't have his mewing
jawline.
on. And it was another athlete who was sort of chiming in. I don't actually think you need to lose weight. I think you need to I don't think you need to lose more body fat and do more cutting. I think you need to see a speech language pathologist because of the way that
Okay.
you hold your mouth and face. And I was like, what is this guy talking about? And even though I had been in the speech language pathology world, for a number of years after having graduated, this is in the not even, I think this was in the early aughts that I found this. And so just the fact that somebody, knew about that, and this is just just a general public individual, and
Yes.
there's no, that they were able to say like, oh, if you're confused about why you need a speech language pathologist, you know, go talk to an orthodontist who is grounded in literature. And here's another thing, this person must have had some academic slant
Right.
because
Or some
they were
kind of exposure to it.
exactly. Yeah, so
Yeah.
I find it curious. We're talking about 11-year-olds who are out there going, oh, I'm gonna put your best foot. And so it is funny. There's some that will do it with the duck lips because that
Yeah.
dies hard, and then others that are like, well, it's the difference really in me coming in like this
Right.
and me coming in a
Oh, I
little bit,
can see the difference.
you're bringing your tongue into where it really should be housed. And interestingly, a lot of, and again, this I have to look at the literature, but a lot of the misarticulations and, difficulties sharpening and having a sufficient tension in sounds of English. For example, for some of my kids who are really more speech-based, either disorder or dysfunction, I look at that crowd and I think, wow, we really do need a certain amount of that tension, because in standard American English, we generally anchor most of our sound production, up kind of between the upper molars as we're doing.
Really? So at the top of
A.
your teeth, you mean?
Yeah, and the
Okay.
top of the back teeth. Yeah. I
Oh,
mean,
okay.
basically what you would call a gingival border the between the gum line and the tooth line, sort of between the top set of molars, is generally and this isn't true for all languages, but in English, for example, if we say the names of the letters of the alphabet in the English that we mostly speak in the US, and this is, again, these are sweeping generalities, for anything where you're making a long vowel sound, you're going to end up there. So A, B, C, D,
Okay.
E, F, G, H, I. And so you're using that high tense characteristic in your speech repertoire, and you're using it in your swallow, and you're using it in your correct oral posture. And so these are the things you go, okay, well, it's not as simple, I think, in our field as, oh, this sound is mispronounced, I'm working on the letter R. What's happening is that the motion isn't there, the tension isn't there, the motility isn't there. And so I think that's what's been so curious to me, is like, this is pretty heady sciencey stuff to really look at, kind of the physiology and motion as a therapist, right? And then to see kids out there being like, here's your foundation posture, like, and they don't always put the cheeks in.
Sure. It's made into pop culture. Okay, so Jane, you are a speech language pathologist. 2 questions here. What does a speech language pathologist do? Which I, just kind of give me some general stuff. And why did you choose this path for your career?
Wow. What does a speech language pathologist do?
Good luck.
And I know that you've had other incredible speech language pathologist guests. I think the general, description, it's pretty broad. The field is quite broad now. Most people who go into speech language pathology are wanting to study some aspect of physiology and communication, and sometimes both, and sometimes kind of one or the other, some aspect. And generally you're looking at, speech sound difficulties, voice difficulties, swallow difficulties across the lifespan. Some therapists will narrow right into really neonatal, infant suckling, swallowing, breath patterning, nursing specialty, while others will go all the way through geriatric services. Some are really working more deeply into the language and communication part of it, and others are a little more, just more attracted to some of that, like that fine motor finessing and what are the qualities of speech. And then others, they love working with kids, they love working with reading, they become really very prolific and do a lot of writing, and they may work in academia. There's just a lot within the field. Generally, you're looking at things that are hidden or not hidden. You might have something where a speech difference is pretty evident to other people, and someone comes to you and says, hey, I want people to attend to what I'm saying, not how I'm saying it. And continually, ask me, do you have an accent, for example, which can be off-putting and distracting. And, we're in a new world where we have to ask the question, like, do I call this a disorder? Do I call this a delay? Like, is someone coming to me for an accent reduction? Are they coming to me for an accent modification? Do they not care either way? They just know their boss can't understand them and they genuinely want you to fix this. So I'm learning to kind of keep that full cultural inclusion, kind of inclusive consideration at the absolute top of what I'm doing, because of the way that we discuss, even things like autism spectrum as opposed to neurodivergence, where on a spectrum, you're implying that someone is catching up to you, or that you are now automatically in a position of power. So we ask that question. We talk about, do these goals matter to my client or to my child? The child I'm serving at school, for example, my student, do I get a kid who turns, 16 and is shown his IEP and he looks at it and says, well, I've never seen any of this.
What's an
and he's
IEP?
Oh, his individual education plan. If he's
Okay.
sorry, I just swept ahead. But yeah, if a child isn't made aware of their goals, how are they invested in this process, and how can we make sure that someone doesn't turn 24, for example, and look back and have some pretty harsh judgments about themselves as not having met up or met the expectation of such and such quality of their communication, being like a grown up in a certain way.
Yeah.
So we need to be very delicate about that, but confident as well that what we're trying to do is maximize their communication potential, and it's infinite in my world. And that leads to the second question. The first time I ever saw a speech language pathologist working, I mean, in my lived experience, it was love at first sight.
Wow.
It really was. I was visiting my mother, who had her hip replaced at a very young age, and she was in her very early 40s. And I went to see her. And when I went into the hospital, the rehabilitation hospital where she was, there was a woman working with another patient who had been in a terrible, terrible accident, and had lost so many abilities. And she was helping him. I had seen him a number of times, but on this particular day, the speech language pathologist, of course, was there. And she was helping him eat. And she was helping him eat in a way that reflected she understood which of the two vocal cords had some level of paresis, to the point that he was having some aspiration and choking, but he was up, and when I met him, he had been just on the Glasgow coma scale. He was very, very impacted. And I think they very much thought they were going to lose him. And so step by step, pretty soon it was eye gaze across the room, and then it was communicating with the hand, and then it was saying, and eventually I just sort of saw this changing. But it was the day that I saw that speech therapist working with him, turning his head in the direction so that she could help him protect his airway. And then
Wow.
swallow. And I can never forget it. I will never forget it. I walked over there, and I remembered walking sort of generally toward them, and my mother was there and had her hands kind of folded smugly, and just kind of looking up at me. She could see that I was, getting shot by an arrow. He just, of like realization and power. And I looked at that and I thought, oh my gosh, I can't imagine a more incredible service. She's going to save this man's life. But they were just visiting, and he was being cheeky, and they're arguing, laughing and goofing off together. And she was like, this is what you're going to have to do. And we're going to get you through this. And I just remember asking my mom, what is that woman's job? What was she doing? And I was very young. I must have been 15 or 16. And I just will never forget her looking up at me, and everything disappeared. And it was like a pillar of light, and she just said that woman is a speech language pathologist. And I was like, that's what I'm doing. And I knew.
It really was love at first sight. So it does exist.
Yeah, there were bumps. There were some bumps. I went to university a year early, so I was really young, taking some seriously hard classes, but got through that. And then not everyone does an undergraduate degree in speech language, but I had an opportunity to do that. And then I did my master's here in Portland, and that was a really wonderful experience. I love the university, and I want to be of service to that university. I owe them a lot, and it's been an amazing career, and it will always be, because there is so much ability to pivot within. And and to see every aspect, like I was joking, like even this idea of, seeing it start to pervade pop culture, and maybe it's a little bit egocentric, but I definitely think like all things, how there's those, philosophical thing, all things go into the sea or the air or whatever, the roomy poems, and for me, it's like it all starts in your mouth. Like, I do think that there's some beautiful aspects of the career, because you are so, this is your communication is the channel between you and other human beings, whether it's your behavior, or it doesn't necessarily even have to be obviously oral communication. There's 1,000 other things, and right down to your breath. And sometimes the breath work is really the beginning of change for our client. And so it's been a pretty interesting journey. And that was my teaser, because I just thought, my goodness, I'm going to talk about speech language pathology and tomorrow. And I just saw kids like, showing I still can't
Yes.
get over it.
And that
And so,
teaser was your idea, and it was a great one, Jane.
yeah, yeah. So there's pieces here for like for an athlete, someone who's trying to get the very highest edge and move from a serious athlete to someone in elite circles.
Yes.
That's an aspect of just one more game, just one more goal, and ultimately that one breath that functions in the body to harness power. And so there's something there that we walk around in this life. We're vertical, we're horizontal, and as Byron Katie would say, the rest is our stories. And
Mhm.
the idea of your speech and breath and your deglutition and eating, all that stuff is kind of how your canister holds its integrity, that the body of you moves around space, and yeah, I feel like it's a really powerful, incredible field that it will never get old. It's just
Are you
amazing.
taking clients, Jane?
I am taking clients, and I do take clients who are not necessarily directive. I do group sort of workshops and talk to people, and I feel like I'm more of a trainer in some ways with some of my
Okay.
clients. But I also do mentoring and advising for other speech language pathologists who, really they don't have the confidence that they want to have with their clinical skill. And yeah, that's been a really a powerful opportunity for me a number of times, and has been something I've been interested in for years, and done a lot of teaching online and coaching and things like that. And I had an opportunity recently. You and I've talked about, how do you stay current, and
Mhm.
we had our state organization meeting turn back up in person, and had that beautiful opportunity this year. And it was really incredible. And I think that was something that has bubbled up for me. So yes, I take clients, and I do try to fit the model of that service provision into their lives. I do a lot
Right.
of telehealth, and try to keep it really flexible for people. That I feel like we're in kind of a new era around that. And like I've had doctor appointments where my doctor's at her house at the end of her bed going, okay, talk to me. It's like, oh my goodness. So
Is
we've
that the
all
world we live in now?
that's the world we live in. I had a client recently, and he took the call and was in a vehicle. It's like, yeah,
Yep.
and teenager, able to pay attention perfectly. It was fine. So yeah, I feel like do you take on new clients is a good question, but it's not in an inflexible model of, come on into my office anymore. I feel like there's
Right.
so much, right, discussion around, how do you make the most of the telehealth environment? And is there an opportunity that you're actually learning an incredible amount more choreography of objects, the grammar of telehealth, where you're leaning in or leaning back,
Mhm.
just all the things about light and hardware. But also there's a grammar. There's a real grammar in online, and that's something that I think many people are actually in articulating, that is its own form of communication
Yes.
skill. This not just digital literacy for our students, but everybody's a videographer today. And so I
Everyone
feel like
is. Everyone that has a cell phone, a smartphone, yes.
exactly. Yeah, yeah. And especially for, our young people who, they may be put on the hook to, like, maybe do a video interview, and
Mhm.
how can I support them with, some of the, I'm going to call them gentle choreography aspects of doing therapy. Things like, don't have a doorway behind a student that's opening and closing if the student has had adverse life events prior to being in your classroom. You know,
Yes. Yes.
situate them so they always have a vantage on the door, and maybe they'll feel like bolting and becoming gone a little less often,
Yes.
somehow, like, watch the state of arousal and nervousness in your client, make sure they have a good, opportunity to be seen at their best too. I get a lot of referrals, come and see this kid, and he's, it's 3:05, they get let out at 3:20, he's restless, can't see. They've got the overhead noise. We got had frozen blueberries and a cookie for dessert, and that was it. There was no other meal today. I don't know when the dessert happened. It's
Yes.
just like that's what came out of the backpack. So, and then I have other students where I go see a girl who's struggling with, reading and not falling asleep, and they think, oh, she's bored. And then you do some deep testing, and you go, wow, this kid can't manipulate syllables. And we're operating in the late high school years. how is she not going to glaze over if some of these foundation skills aren't there? So
And
looking at that for telehealth, like how do I tap in with a client and go deep into the things that are important to them,
And what
Yeah.
I found, Jane, and we've discussed this at length, is that what kids are presenting, what they're presenting in class, whether that's elementary, middle, high school, it's normally never what that is. It's normally
Right.
never the case. They're presenting, angry or throwing
Right.
chairs or whatever. It's never that. It's
Right.
always something else.
Right.
But of course, we're not laying blame on teachers because they have
Oh, no,
way too
no.
much they
Right.
have to do. But I'm just saying, when a
Right.
kid presents, it's normally never that.
Right.
For clients or my listeners who want to reach out to you, maybe they want you to, mentor them in this field of speech language pathology, or maybe they have a child that, they would like for you to speak to. How can someone reach out to you?
Easy to reach me through my website, and I'm reachable by email at jane@firesidespeech.com. And I think maybe you might be able to share my QR that leads you right to booking a free call with me. Yeah, I definitely feel like just about anyone could benefit from. I mean, I could, everyone can benefit from some of these concepts to build stability and anchor a facial and essentially all trunk movement so that everything else is sort of possible. Yeah, happy to support and reach out with you. And I was really pleased to be here today and get to talk about these big juicy things. And I know we kind of deep dove, and yeah, happy to come back anytime. I love what you get done and what you get thought, and
Thank you.
it feels such a think tank of a podcast. I've been happy to watch back.
Thank you. Thank you. What are some of the common challenges that some of your clients present whenever you meet with them?
That's a good question. I mean, that actually helps kind of like frame up some of this.
Mhm.
There's a certain base of just noticeable, like I was saying, the invisible and the visible, whereas like a reading deficit is not going to necessarily be super visible, on the street. Typically, you'll get someone who has struggled through and loosened the jar with a few therapists and is having a hard time, remediating later to develop sounds like R's and, L's and SH's and things of that nature. So sometimes it's just straight speech. A lot of times there's more going on where the organization, the motor pattern is disturbed and they're having a really hard time, fluently coming out. They have more what's called praxis, so difficulty, kind of coordinating. And the idea there is to
Like coordinating words or speech?
coordinating the speech sound, like the movement required for speech sounds, just
Okay.
isn't coming out. And that will be characterized more by inconsistent error patterns versus consistent simplifications, where someone's compensating and doesn't have the tongue tension right, and so then they'll spread the tension into their lips and jaw or somewhere else, and to try to make a certain sound, like R, for example. So sometimes I'm the last call, and more I'm the first call because of people know what I do, and that's been pretty awesome. I feel happy about that. And now even athletes, I have a lot of actually interestingly, I've been helping a lot of people who are in provider roles,
Okay.
and they're having a hard time they're edging to burnout, and they're having a hard time managing their stewardship, their responsibility, their students, their athletes, their whatever, in the context of their own chronic illness or new set of burdens, or they're in a pivot. And what I see there is that there was an ability to hold it together for their speech or language concern or both. And that when they're tapped, that it was at a cost. And it just is the thing that kind of collapses. And then what will happen often is someone will come to me and say, hey, I'm reviewing the recordings that I've made for my online content. And I don't like what I sound like.
Wow.
And it's not just the echoey speech of like, oh, the bone where it echoes and you go, oh, is my voice funny? They're noticing there's a speech communication concern. They're noticing an error pattern, a stutter pattern, something that they say, you know what, I need to fix this, or they don't like, they don't know how to mew. So they're
The mew.
right. They're like, something's off the way that my head's on my neck. I'm not straight how I'm receiving that when I watch it back. I don't care for how it looks. I don't feel like it looks professional or, somehow pulled together. And I think I've had a lot of people come to me about that. And then we've dug in and figured, wow, oh, and we also have sleep apnea. Oh, we also have this. And so you'll see that there are other airway and facial structure effects. And then you have something more to work for and work with your client. Yeah, so it's been pretty awesome. So I've done that, and I've worked with a number of sort of self-diagnosed or later diagnosed folks who are in the neurodivergent culture and world, and they will communicate with me and say, hey, these are some of my areas of opportunity and vulnerability, and I already know what they are, and that's what I call them, but can you help me get better at this stuff?
What's neurodivergent?
Neurodivergence is wow, that would be an entire podcast.
So far we have 3 follow-up podcasts we need to do, Jay.
Yeah, we definitely do. Neurodivergence captures, anyone who is maybe thinking a little differently than someone else. There's people who are in the autism world will sometimes consider themselves neurodivergent. Not all those who are autistic would call themselves that. When I was in graduate school, you were never to call somebody autistic. You were supposed to say person with autism. That's not true. There's the idea of intercultural appropriation. You want to get, really informed about that. But neurodivergence captures a little bit broader range of atypicality. Like, that's just, we're not even calling it atypicality because it just means you're neurodivergent. It means your thinking is different than someone else's. And it's not that there's this normative population and then this autistic, individual. A good example would be, from there's been recent research, and I have to go back and capture this because it's a little bit out of where I was going to go, but it's this idea that, we've always been told that individuals with autism are really terrible at interpreting facial expressions. And we're coming to find out that they're actually decently better and able to interpret facial expressions of another person with autism.
Really?
Yeah, and that's not very old in the literature, and I'll have to look that up, and then we can put it into your comments and description at some point. But I remember reading through that and thinking, oh yeah, we know that's an intercultural, an intracultural skill, and so it is unique to think that if you feel that you're neurodivergent, you're neurodivergent. But if you have been diagnosed with autism, you may also say, I don't consider myself on a spectrum, because a spectrum implies that I'm going to get closer and closer to you as a norm. And there's this, I have worse or better autism than someone else. And I think people are pushing back on that, that descriptor, although I still see it readily used, all over the place. But I think more and more people are talking about the world of neurodivergence. And even the other reason why that's pretty powerful is because then you're associating it with neuroplasticity. And you're thinking, is neuroplasticity is the notion that you can change how you think, that your brain patterns can be rewired, that you can think differently, you can diverge from you can unschool yourself, you can unlearn something. And I think that's the powerful thing, is when we all think about it in terms of what we can learn and what we can unlearn, and learn to do or think a new way. And so, yeah, as above, so below, that we reflect those changes in how we talk about all manner of human beings within the culture of speech language pathologists. We have certain kinds of, for example, academic terms or descriptors for the strategies or the therapeutic techniques we use, and they do evolve over time. And so
as should everything, like the way you think, the way you behave.
Oh, 100%.
Those things should evolve. Yes.
Mm-hmm. Yeah. And so it is interesting, a number of questions that people have about speech language pathologists in terms of even something as simple as swallowing. People talk about AI and how robots are going to take over the world. And certainly, even in our literature right now, our most recent speech language journal, there's lots of stuff about AI coming into every profession. But until a robot can take, a piece of banana and make it into itself, right? The deglutition, the eating, the becoming, the nutritive and digestion properties of a human being. I don't think we've copied that successfully yet. And it is intriguing to think that, again, kind of like I was saying, the idea that your speech communication is this fluid river between you and someone else. And it's this also fluid river between you and objects outside of your body. And I think I've always been kind of a big thinker, but I still consider my own body, with all of my life experience, as an external environment. It's the closest one to me, but it's still an external environment to who I am. And I feel like that is the gem of what I want to accomplish in my work with my clients and students, is that I want them to have this beautiful access, so that as much as they possibly want to or don't want to of who they are, can flow in and out of that river and interact, like that they have their health, at a level that is profound, that they don't just have.
I was going to ask you much later, like, what's your intention in this space? But you literally just answered that question.
Yeah. That is, I mean, definitely. I feel like, just when I saw that man, and it was like, whoa, because of her knowledge, she gets to have the privilege of essentially touching his life force, like allowing, or maybe that's not the right word. It's not there's contact, so that he can release his life force, literally his life force. And I just thought that was so powerful. And we know what food is, and what it is to all of us is, I mean, again, podcast after episode about the joy, the interaction. Yes, there are hangups. Yes, there's dysfunction, but at the very, very root of it, that's even an outside environment to who we are. And so that idea of, really treating people, that it isn't just like, there are times when I'm working with someone and I go, okay, we're going to keep practicing this, and we're going to practice past mistakes, because at the beginning, you're unconsciously not getting it, not correct. We'll call it correct, but even though that's a little bit of a simplification, and then they become consciously incorrect, like, oh, this is not what I'm doing, that's not what I'm trying to say, that's not what I want my essence to, something's not right. And then you get them to a point with the therapy, you're consciously correct, hey, I'm getting this, I'm doing this. And then what you really want is this, like, I'm unconsciously correct, and I'm out in the, now that river is flow, right? Now that you don't have dams in the river of people are getting distracted, I'm getting distracted, I can't have access to my material. It's kind of like, you don't speak to speak, you speak for this. You speak for this communication. And it's kind of like, when you learn to read, you don't read to read after a certain time, you're reading to access everything else.
The information and hopefully the love of reading. Let's talk about swallowing and eating, some challenges that some people may experience with that. What are some early signs or symptoms of swallowing difficulties that people may need to look for?
Oh, so great. It does depend a little bit through the lifespan. For example, you could be working with a really small infant population that, you're dealing with latch difficulties. You could be dealing with an elder population who, for example, the tonicity is, they have some deterioration, they have a little bit of calcification, they have little problems. You can have healthy swallow your whole life, but if you have, deficiencies in the tissue or in the motion, or in the chemistry, you can struggle. And I think some things like, oh, my mom always coughs after she eats. Maybe 5 minutes later, she kind of goes into some coughing spells. And you already know that it isn't inflammatory, like she doesn't have an allergy to something. Because that can be a thing too. All of a sudden they have histamine and now they're coughing and having problems, and they're not sneezing. And so you go, wow, it's not going to be allergies. And we go through periods of life where we can develop some sensitivities to different things, kind of like when a woman goes through, puberty or onset of menstruation, and then you have, offset, and you have kind of like that puberty in reverse. So during that time, you might see a warning sign might be just, having more difficulty when foods are dry, or not having enough saliva production, having a dry mouth. If you're on certain medications, this can be a side effect of medications, is a dry mouth. Other things would be like frequent coughing while you're eating on foods that are a mixed texture. So that would be like if I bite into a piece of watermelon, for example, and I'm chewing the solids, the liquid goes quickly to the back of my throat, and suddenly I'm just having these little micro aspirations. I'm finding myself having a hard time managing the liquid. So the mixed texture can be, if you're struggling with some of that can be an indication that maybe you need some strategies. Yeah. And I mean, obviously, this is for the general population. If you have, the onset of, for example, something like Parkinson's disease, or Parkinsonism within another degenerative disease, or as a function of medication or head injury or what have you, you may struggle. And it might be that that's an early marker. Like if you have tremulousness, or you have, just late initiation of the swallow, or you find that, and the swallow, of course, this is to explain too, that it happens in phases. Okay, so you're kind of like, you're chewing, then you're organizing it, then you're pressing it, kind of like you're doing, remember the dance move, the worm?
Yeah, I was so good at the worm.
No, the worm, it was a thing. And remember, there were 2 ways to do it.
Was it?
Yeah, you could
go, are you talking about frontwards and backwards?
Yeah, you could go and you could drop down on the chest. So you're trying to do tongue tip. Tongue tip is going up and it's stripping the food back. Tongue tip is going up and it's stripping the food back. And you will see some part of your caseload come to you with the reverse swallow, and they're doing the worm. And it is kind of cute, because every once in a while, I mean, like, look, the worm is like, I don't know if anyone's jumping down on their chest in 2024.
They need to be.
They probably need to be. So the worm, okay, and we won't put that in our next chapters, but the worm is a good way to explain that the propelling should be coming down, not accidentally forward and then clunking. And so there are different phases of the swallow, and the oral phase swallow is where I've spent most of my time. Later phase swallow, you'll get into things where you need to go get a barium swallow assessment, and that typically will happen in a clinic or hospital. And then they're watching that. They're watching, is the soft tissue in reverse? What's going on? But indications that you may have a reverse swallow would be lots of pressure on the teeth and splaying of the teeth, would be like over reddening of the mouth tissue, inability to swallow with the mouth closed and the lips apart. You should not be seeing any bit of your tongue sticking through, those kinds of things. If you were to see that, in a young child, or, moving into teens and adulthood, you'll see sort of this natural, this is where the Mew stuff kind of comes in, that you'll see this natural consequence. And there's, I can see why they use the word controversial sometimes, because the question is like, well, you can't really double blind a person and have a study of whether they had the reverse swallow corrected. If they would have, how much less would they have affected their teeth, and things like that. But, and of course it's going to depend. My angle is a little bit stilted. I suffer from Ehlers-Danlos syndrome. And so my tissue collapses more than another person. So I'm always a little bit, looking at that. I have to be careful to look at that from the general standpoint of sort of looking at the general public.
Right. So Jane, as a speech language pathologist, how do you work with patients to help them to regain the confidence, or give them tangible tools when it comes to like eating and swallowing?
This is so important. And it's, those answers where you go, oh gosh, it sort of depends on the client, Crystal. I mean, it really does. Okay. And here's why, because just like the swallow has phases, you want to know what is the root of where it goes off the rails for them. Okay. So sometimes the confidence is, I'm going to have you learn about how you're swallowing, because if you know, for example, that you often choke on thins, and you're in like early, like new to you assisted living, and but you're pretty social, you're very mobile, you can get up, you can do the things, you might try, hey, I'm not going to start saying like, hey, you shouldn't be going into the lunchroom and having, unsupervised meals, blah, blah. If this person has all their faculties and all their skills, and they're just really eager and interested, they might try something as simple as drinking through a straw. because when they tip down, they can organize, they have a little bit more time. They might try something as simple as changing temperatures. I noticed that some people who have swallowing issues, they are often getting very cold drinks or very hot drinks. And you would think, oh no, this is bad news. You're going to hurt yourself. And that's true if they have limited sensitivity, but if they have limited mobility and they need to set that reflex going a little bit better, the 97-degree water that's just like completely body temperature, or maybe a little bit lower because mouth's a little bit further out, you might go, okay, well, you're not going to know where it is in space. Like, in order for you to feel where it is, you can manipulate things like textures and temperatures. And it's not just chemistry. Some people crave the fizzy, and some people are like, I can't handle that because there's too much going on. And so asking them, trying to figure out with them what will give them the most confidence. And sometimes what gives them the most confidence is just learning about where things are getting a little off the rails. And you go, okay, let's help you dissect this down just a little bit so that you can build it back up. It's kind of like, tacos deconstructed for dinner. Everybody sort of take the things they want and make their amazing, individualized custom situation. But you do want to educate and help people understand this is what normal function is going to feel like. Right. Let's get you as best we can to that. And then we're going to fade out the support. See if you can, holding is kind of healing kind of thing. I've learned that from recent chiropractor friend. And so now I'm like, oh, it's really kind of about that. Like get you into optimal function and use and plasticity, like that word, you're able to kind of roll with it. And then you have more freedom. And that's what builds your confidence. I think freedom, it's funny, people think freedom is like, just being, at kind of, I don't know, enchained by your compulsions. That's not really freedom, right? Freedom is when you're utterly able to respond in any way needed around you, that you're completely free to respond. And I think that's true in our own bodies. And so we can regain a little bit of individual freedom, kind of in that metaphor I was talking about, that you're back here. And if there's anything interrupting this flow of you that you don't like, right? Because people have their guard up. They don't have to be 1,000% open. But as far as like, they want to, and they find that they cannot. And that's where the communication support comes in. So same thing with swallowing, because obviously, swallowing, and nobody wants to be like having a big coughing episode and then reassuring everybody, look, I'm not sick, right?
and I don't have COVID, I don't have the flu.
Right, it's allergies, and maybe it is, but maybe it's not. So but swallowing and the phase that I'm more typically working with is that front mouth carriage, it has dental involvement. There's just different stuff going on, and I feel like it can really, really make a difference, especially, for someone who is coming to me and saying, I had already worked on this before. And so it's an area of real sensitivity and vulnerability. I want to work on it again. And I haven't felt strong enough to do it because I have the hangups. Like I was kind of intimating, there were these hangups, like I feel less than, or I feel like I didn't work hard enough, like I think for most of our kids, going through the past 10 years, there's been a lot of like, and especially, I don't know, Gen X would relate to this quite well, I think, in a broad strokes here, Crystal. I'm just, just making sweeping generality. I have no literature to back this up, but I think, Gen X, did a lot of, hey, in order to fly, do something marketable and flap your arms. And then there was a lot of like, oh, I'm not getting off the ground. And you're going to need to flap harder. And, I'm not convinced that's always the best move. And then I feel like this most recent generation, kind of post-pando, I'm looking back and I'm like, wow, they literally had to invent the airplane while it was in flight.
Yes.
And so I feel like the world is ready for speech language pathology. No, we're ready for looking at, kind of coming out of the cave more realistically and consciously. I feel like the cave of the pandemic was, I think adults are eager to just not talk about it anymore. We're done. And we have so many young people whose trajectory was quite drastically interrupted.
From one day to the next. It was
horrible. So much so that like, regardless of the sort of the health crisis and regardless of the medicalization and all the things, they literally had a mask on. And it's not that that's bad or wrong. I'm not pro or anti. And in the slightest, what I'm asking is, does it have an impact um, on us? And I think what's kind of puzzling is that there were moments where I had sort of, the secret life of babies, where the baby's over dad's shoulder or mom or whomever, and you look up and the baby sees you, and there's the mask on the baby and the mask on you, and you just see the eyes, and they're, you can see they're still waving at you, and there's still all this communication, going on. But as far as the kids who really did have more of those just unexplained and ever always there little barriers between their speech production and their message getting out clearly and cleanly, that crowd, lost something, during that time. And so for me, it's really more about, instead of, getting hung up on the particulars of speech and not seeing speech, it's more about asking, are we ready to say, where were we? And if we do that, are we ready to grieve what was lost, if we know?
And acknowledge it. You have to acknowledge it first.
Exactly. And so I think in our field of communication, it's only natural that we think about that a little more than someone else who's in a different trade entirely. And they just need to get back to it. And then there's a consequence there, right? If you just sort of stuff that you needed to acknowledge something. I mean, I don't know if you've ever had that happen, and some of your listeners will relate when somebody says, sounds like you're grieving. And then you just unload.
Yeah.
Right. Because you're like, wow.
You just release. I mean, you don't realize you've been holding it for so long, long.
So I see that confidence as part of that ability. Like when you do the excavation necessary to feel the greater joy, you're increasing your capacity by disemburdening yourself. If there's something about a time when you couldn't communicate effectively or neatly or in a way that you liked or whatever. So I think you might see that in some of your viewers and listeners who, they themselves are presenters, for example, and that they go through a period of time and think, man, that whole couple years when I got started, I didn't like how I was communicating. I didn't feel confident to take off in my, like the way that you are, they don't feel like they can be authentic like that, because what they were authentically was when they were little and they felt judged and like they weren't good enough. There's something about the way they were communicating that wasn't effective and wasn't somehow correct. Right. And so as therapists, we must consider that. And
that's a lot of layers to break down and break through.
Yeah. And it's pretty tender. I think there's a lot of, but it can also be, you do have some clients where you read it like, okay, they're great at soccer, they're great at sports, they're, they got a great job, they're doing things and they play indoor or whatever. And they come to you and say, this is just like, it's like any other skill. I've got to learn it. And they have that kind of, let's just get this done, and they get it done. And but I do think, it unleashes this, like you said, there's this kind of like release of like, oh, this is what it feels like when I get this right. And it can be very, very healing. And in that same thought, we don't, no one's expecting anybody to be in some kind of perfection. I think that's the difficult part, is that when you do complete what you need to become a speech language pathologist, you're doing formalized test measures, and those test measures are normed on a certain population, and just no different than saying, oh, that's great that everyone's going to get a shot. Was it normed on pregnant people because I happen to be pregnant? Like probably not. So sometimes you got to chance it. And so with this, it's more about asking, it's a criterion reference thing. And I don't mean to go back to, health, but it is your health, when it's your communication, because it's the vitality of how you interact with other human beings on this planet, on your turn here. These are your 100 years that you're going to be here. And these are your people. This is your crowd. So your communication actually matters, even if you're more of a homebody. But yeah, I feel like there are a lot of layers, and you go as deep as a client needs. And I think you are just humble to that, and you treasure that, and you have a respect for that. You bring a reverence to the field, and you're going to there's nothing you cannot accomplish with your patients and clients. But what a rewarding career. I couldn't say enough good things about it. Long and arduous to get through.
Excellent.
Yeah.
Let's talk about nose and mouth functions. And you've touched on this a great deal throughout the podcast. How does nasal functions relate to eating and drinking abilities? Because I don't know if people think that your nose has anything to do with that.
Yeah. And I think, this is kind of funny. And I was curious if this would come up, and it's a little bit of I'm going to try and loop it in.
Okay.
A lot of what has deepened for me professionally about the body has been, I'll say, amplified, clarified, and intensified by owning animals. I live rurally, and I have a little herd of goats that I take care of that are my working animals, and they are part of my land clearing. And I've had them and enjoyed them, and they're my pets, and like I said, they're working animals. But I've made a lot of observations about their sensory organs and their eyes and how they end up horizontal even when their head's down, and all kinds of things about them. And one of the things that I thought about a lot, especially when I bred a couple of my goats and was watching, observing for that whole process, is just the placement, the evolutionary or universalized or godly placement of the nose above the mouth. And the reason that that's all tangled up together is so that, if I, go to ingest something and I just get one last moment to, it doesn't smell right. I remember I went around the world by myself for a year and met incredible people and did incredible things. And I remember meeting a guy from the UK who just encouraged me every time. He was like, order the eggs. And I'm like, why am I ordering eggs? And he was like, you'll know when the egg is off. And I'm like, oh, that's a good comment. And that's become a thing, a meme in my house with my family. And, the goat knows most of the time. They can get into trouble, but the goat knows, they know when an egg is off, and I think that's why we have that last chance to smell what we're eating. We also have had a lot of opportunity to use this. My husband went through cancer, and he's doing better now, as I've shared with you a little bit of this. And but when we were trying to get he had 2 major surgeries, and we were trying to get things back online, get his intestines to start working again after a very significant surgery. One of the techniques that I used was like, if he's able to do it, we're going to walk him down to that darn cafeteria, because he'd been multiple days. We were trying to get this, what they call an ileus, or the sleeping intestines, to be able to figure, we've got to do this peristalsis. We've got to turn back on. And what was so spectacular was that it pretty much worked. I mean, it was inside of several hours, and it started up again, and he lost the suction, and everything started on solid foods. And so this was the idea that I was trying to capture, was like, your digestion actually starts out here in your nose. Like you smell something, you've got saliva triggered, your things are starting to roll. Like the wave of ingestion begins quite a bit earlier than I think people think. And it begins, in your brain. I need to look up this other study that it was a guest with Andrew Huberman, and I need to look her up again, but she was talking about the idea of measuring a hormone activity in the body when people are given the same shake with the same calories. And this is actually pretty recent. And if they're told that it's really great for them, and if they're told that it's a really naughty shake, it's like just super, super heavy, and they actually see changes in that I think it was ghrelin and a couple other hormones and stuff. And it was just really, really compelling. I was like, wow, that so your digestion's starting. What they're saying is it's actually starting way out here with your thought process in your nose. And then getting back to the kind of your original sort of question on how to tie this together, that the organization of your chewing, if you have a lack of rotary chewing, if you don't have grading in your jaw, if you're really always open or closed, and you haven't had the maturation to move into the softer landings of articulation, and how does that play out in your chewing? Are you more of a muncher? Are you breaking food down enough? Are you, because there are certain, burdens of motion and burdens of chemical activity that are present all along the digestive tract. And so it's been almost revolutionary to have animals and just watch that process, from me standing in the feed store or at a farm where I'm getting bales and thinking, okay, that's going to end up in my animal. in a certain way, and that's going to end up in my soil, and that's going to end up denatured down and broken down and in my garden and then into my food and then through me. And so I stand in that grass field and I just imagine the full on, and it's not, I'm not always thinking of those, things like so deeply.
You're a very deep thinker.
Yeah. But definitely in terms of the practicality of nasal breathing, there's a very important coordination, for example, that has to happen. Another one of the, looping back to the earlier question about what are some of those warning signs, if you're taking gasp breaths or like rescue breaths after you're chewing and swallowing, so you're chewing and then finding that you're not coordinating suck, swallow, breathe in a baby or a young child, if you're not coordinating, or if you find that you're generally out of breath and quite fatigued after eating. And we do see this affect people into their older age, where you see someone who's found that they've collapsed or something, and they'll call it postprandial. It means like after they ate, they collapsed. So sometimes things like that, like with Ehlers-Danlos, I developed postural orthostatic syndrome, and so my blood volume would shunt. I would have a low blood volume, it would shunt to my stomach, and I would end up really lightheaded after eating. So those kind of things, if you're lightheaded after eating just because it's a lot of work, you can go all the way back to like, see, sometimes that's happening because someone doesn't chew. They're just really eating large swallows. And why are they doing that? Do they have long-standing facial pain? Or I have kids where I can actually see some asymmetry and overdevelopment of one side because they truly only chew on one side. I see that a lot. And then they don't ever chew on this side. So sometimes they just need to get something fixed, and then they can start to practice and do it. But it's kind of like, the function is, I don't treat disease or illness, but I do treat dysfunction. And like a perfect example would be if I were born and I had this adhesion here, and I have
like between your thumb and your index finger.
Yeah, if I have a index finger to thumb adhesion, and then I have that surgically released, and if my musculature and everything else is fine, and I don't have a lot of difficulty with the fascia and scarring, but I still hold my hand like this
because you're used to it. It's habit,
right? So if I still have my thumb right alongside my index, sometimes you have to work at improving the function. And so, to kind of sum it up, you think of a speech language pathologist as very specialized physical therapist for like head, neck, and face, but you also have this full, at least you hope you do, you want to, and I can help you if you don't, the real sense of how that mobility and that the control of the whole head, neck, and face, and all these articulators, how does that work with my carriage in my body, my gait when I'm walking around? Are there ascending or potentially descending disturbances that can be supported and rectified so that you have a little bit better, long-term outcome? And I think it's really not even so much outcome, it's more about process, right? It's like, are you walking, you say, oh, well, if you have a problem in your foot, you go to a PT. That's true. But I've had a lot of PT referrals where someone says, yeah, this is originating up in the scalenes. This is originating in this person's, sternocleidomastoid, which like comes around from styloid process down into your clavicle. So you go, okay, well, if there's an issue up in here, how is it affecting this client? Even things like, for example, handwriting, you would think, oh, that has nothing to do with the speech teacher. I'm like, well, it will if a client has an unintegrated reflex, for example, or something that that whatever is making that difficult is also probably affecting, speech and head, neck, and face carriage. So yeah, lots of opportunity for coordinating with other professionals for folks as well.
I have enjoyed this podcast so much, Jane. We're over an hour, but if you give me a few more minutes, I have 2 more questions.
Absolutely.
That I just have to ask you. What are some techniques or some exercises that people can do to improve their mouth function and better eating and better drinking?
Wow. Something that would help everyone. Let's see. I would say, yeah, this is tricky. I would probably think that as far as like, well, I don't know about individual exercises, but certainly, yeah, work on your breath. Like, I think work on your breath catch yourself and say to yourself, okay, are there times that I'm over breathing? Am I driving up, a sympathetic response? Am I getting myself wound up with a bunch of oral breath that's too deep or too frequent? I know for women, my understanding is that women will, in their luteal phase, not even be aware of it and have a more rapid breath rate, and that can be driving what we call hormonal anxiety. So there can be some pieces there. I think, for men, it would be, I think, keep an eye on your snoring habits. That's always, and for women as well, keep an eye. That's probably a generic one. But get that investigated. I think for speech and language specifically, I don't want to know about individual exercises. It's just a really hard one because it can be so different, from one individual to the next. But I would say, like, generally focusing on nasal breathing and making sure that you have a good airway and good return, and that you get good sleep that's restorative, and kind of start with like your basic pillars. And certainly if you perceive that you have an issue with swallowing or occlusion or dental things of that nature, talk to other professionals, and maybe they need to be on Netflix. No, I'm just kidding.
It's a Netflix special, y'all.
Yeah, catch up with Netflix. But I definitely think that focusing on spending some time in that restorative breath space, and whatever that needs to look like for an individual, it can only benefit them. Just like that, kind of staying in touch with the contemplative practice of some kind that can help you capture, like, oh, I need to spend more time in a calm breath pattern. And I think people need more of that these days, for sure.
I think people, like you said, they need more of that anyway, whether you're eating or drinking or whatever, you need that anyway. Okay, so my final question for you, Jane, who do you think would make a great guest on the podcast? But you have to help me get them on.
I would love I recently met someone through some business courses I'm taking, and his name is Roland Salas. And he was a fantastic person to visit with and talk with, and just knows how to find overlap between industry and among people, and just was a really, really neat guy. He is the owner of Ripple Effect Media, so I could probably set this up.
Perfect. Thank you so much, Jane. I have enjoyed this podcast, and I enjoy like talking to you before we even got on the podcast.
Oh yeah, it's just fantastic to visit with you, and I'm so thankful to be able to be here. And these questions, they're real thinkers, because you just have such a good background, and it's so widespread and yet sort of specialized as well. So it just was really perfect for me to be able to talk about things, in broad strokes, but also really with some specificity. I hope it was your fellowship. It's great.
It's one of the things that I love about this podcast, because it enables me to learn and continue to learn about subjects and careers and people that I would have never, just in like my common everyday general life, thought to learn. So like my questions reflect that. When I'm asking questions, like I'm literally asking questions that I just don't know. It's one of my favorite things about this podcast.
Oh yeah. Well, and now it inspires anyone who comes on, because now I leave this podcast and I think, man, I got some more reading to do. I got some more watching and reading to do. So it's been an absolute pleasure, and I can't wait to see you again next.
Excellent. Again, thank you so much for being on the podcast, Jane.
You're welcome. We'll see you again.
And to my audience and to my listeners, thank you so much for tuning in and watching. You can get Jane's podcast and all of my other podcasts on YouTube Podcasts and the Apple Podcasts. And remember, you always have time to listen and learn on the go.